Yeah, thanks, Dusty, for inviting me. I don't know, my talk probably won't be quite as exciting as Dr. Young. It's nothing new and revolutionary, but we are really excited about the Farm Bill. So I think we all are. Most folks in this room had some probably conversations around this, either on the long development, the long road it took to get here, or kind of already, speculating what it is and what it isn't going to be. So I'm going to say what I can. Not all the details are finalized and developed yet. We're still awaiting some final decisions from our Secretary Perdue, our Secretary of Agriculture, but I am going to share what I can so you guys have a good idea of where we're going and what we want to do with the dollars as a collective we. So you may have heard this referred to as the three-legged stool or three pillars. Lots of terms in that area have been used. So it's section 12,101 of the Farm Bill. If anybody's had the chance to peruse the 564 pages, I think it is, of the Farm Bill, again, how can I make this really exciting, right? This is one tiny piece, and one tiny piece of the what comes through USDA. So just so you all know, we are certainly super excited about it in this room because we are all direct stakeholders, but it is part of a big process and a big initiative across USDA, which is causing some of the reasons why we don't have a specific decision on some of the main points I think many of you are interested in. But the three legs of the stool are the National Animal Health Laboratory Network. Actually, Christy, Dr. Liacno, is going to talk after me specifically about the NOLN, and so I won't speak too much about that related to the Farm Bill, just a quick overview. But that's an existing program we have that these dollars will support, and then it creates two new programs for us. So the National Animal Health Preparedness and Response Program is brand new. It gives us some parameters about how we're going to stand up that program in the Farm Bill language, and then the National Animal Health Vaccine Bank. And it's actually technically Vaccine and Countermeasures Bank, and I'm going to talk about that in a minute because that's an important point that we don't want to forget as we talk through this. So as Dr. Young mentioned, 12,101 is titled Animal Disease Prevention and Management. It contains these three pillars, and we're going to do a little math. The math's going to be pretty easy. So there's a total of $150 million over 5 years. Okay? Total, $150 million over 5 years divided by three programs. It's not a whole lot of money we're talking about. Again, we are so thankful, and I think we can do tons. We, the collective we, can do tons with these dollars. But just to remember, as we're all talking about priorities, there's a lot to fit in here with these dollars. We received it in a lump sum up front, $120 million. So kind of they deposit that in our account for us to spend with a couple provisions. So that's what we have to spend over 4 years. And then we have to put $5 million per year in the preparedness and response pillar. So there's a minimum requirement there. And then the last year, we have to put $18 million in there. So kind of figuring out how we're going to distribute this and allocate the dollars is actually, that's at the Secretary's level right now. So we have provided ideas. We've provided the input that you all have given us collectively over sessions like this at USHA, through resolutions at different meetings, from our sector meetings, and where we hear from everybody as stakeholders. We provided that as ideas. Mr. Perdue is conducting listening sessions. You may have participated. I know they had virtual options in March to hear some formal sessions. And as we move forward, we will be doing that. So just back to the math. So we've got this lump sum, and it's no-year funds. That's the other really important thing to remember. So for us, that means we don't have to spend it every year. Because for many of you in the state and federal side that are aware, when you have appropriated dollars, they have to get spent down every year. Or they disappear and they go away. So the no-year clause in there is really significant for all of us. So that means we can support projects over years and not have to worry so much about that fiscal year end. So just a little bit I mentioned. So these are some of the key pieces I want to point out that we hone in on the Farm Bill, in the Farm Bill language. So again, I mentioned it's no year money, so they're available until they're expended. We got some now. We'll get another bolstering, but that's really good news. It's mandatory funds. That means that we get them. It's done. That's coming from the Commodity Credit Corporation. This is the same way many of our outbreak response funds or indemnity funds come from, that CCC funding. But it's mandatory, and it also means it's not appropriated. So that's, again, really good. It ties back to it can't be taken away when the budget's flux and administrations change and all of that. So we all have this money, which is really exciting. The Faca exemption is actually stated, so that means we can work directly with our stakeholders. So we have to be sometimes very careful in receiving guidance and advice from our stakeholders. I think we do, in general, a really good job of not getting in the way of the Federal Advisory Committee Act, but it explicitly states that how we receive advice of this is for the Farm Bill and our priorities is exempt. So that really also helps us out in having conversations. There are administrative costs. So that means for USDA. So that means we can hire people to directly support this program. Really important when we're trying to move things through and be efficient, because as many of you have heard, and I know many of you are also suffering from hiring folks in different programs. So we have money set aside internally, USDA, to support it and to support folks that are going to help us with it in terms of the governance, and I'll talk about that in a minute. So those are all really important pieces for us as we move forward and how we stand this up. So we've been doing planning for, Christy, I don't know, over a year in preparation, in the event, in the hope that we would get Farm Bill dollars, not knowing how much it is, not knowing which pillars or which legs of the stools might get the funding. We've been working internally for over a year to figure to be as ready as we could be when we got the dollars. So the first piece is the funding distribution and prioritization. As I mentioned, we have ideas. We've passed our ideas forward from internally. Secretary Perdue is gathering other input at the moment. I know we have letters from folks that have written it, probably represented by people in this room, to really decide how that lump sum of dollars is going to be distributed. In the Farm Bill, it says it's up to our Secretary of Agriculture to make that decision. So he is working it, he's weighing on it. So we don't know yet. We don't know how much each of the pillars are going to get, except for that clause where we have the $5 million minimum for the Preparedness and Response Program 1. As I mentioned, we've listened over years, what are your priorities? What do you guys tell us? What do you write letters about? What do you pass resolutions on that we all need to do to be able to advance some of these areas? And in that, I just want to also say that we have, on the preparedness and response side, there's some 4 goals that we internally, and this isn't set in stone, this isn't anything. I just want to give you some insight into the internal conversation that we had put forward in the areas of biosecurity and prevention is 1, detection and surveillance is 2nd, preparedness and response is 3rd, outreach and education. So, and that ended up matching very well with the 8 activities that are actually published in the Farm Bill that it specifies we will do. And the 8 activities go into a lot more detail. But what we had said, well, these would be the goals if we were to ever get this money, matches very well with the actual language that's in there. So that's good. That means I think what we were thinking and our priorities are, we're close to the same page. And again, that's based on what we've heard from you all over the years. And that was for the preparedness. The only other point I want to make on the Animal Vaccine and Countermeasures Bank piece is that the instructions or the language in the Farm Bill is to stockpile vaccine and countermeasures. And why that's really important is because we felt that in many cases, just having vaccine stockpiled, while it's really good, and you listed so many of the same challenges we are very, very aware of, is great. But sometimes if we don't have compatible diagnostics, it really does us no good at all if we can't distinguish vaccinated from unvaccinated animals, etc. And so it's a bit broader than just vaccine. However, in the language of the Farm Bill, it is written that FMD vaccine will be our first priority, and of course we will carry that out because that's our direction. So there's been, of course, much input from industries such as poultry industry that aren't so worried about FMD directly, about where are we, hey, why aren't we here? We hear them, we agree, but the language in the Farm Bill is we will prioritize FMD vaccine. That doesn't mean, though, that's all we will do. So I just want to point that out. So I think the next is governance, and I just wanted to mention a little bit about this. So we've thought over our year and some of planning, how are we going to execute? How are you going to implement this? And one of the key pieces is governance and ensuring that our stakeholders are represented and heard, and that we can make this process as fair as possible. And so what we have proposed internally, again, and this isn't widely yet shared, but we don't anticipate this is a piece of debate at all. It's more of the distribution that our Secretary Purdue's deciding on. But we will have an oversight board for the Farm Bill to make sure that across our 3 pillars we're not overlapping, we're not duplicating, we're not doing things inefficiently. That board will have knowledge of what each one of the pillars are doing and make recommendations to our Deputy Administrator, who will be one of the deciding factors about how the dollars are actually spent, what projects are getting dollars. So we know that plant protection and quarantine, which is in our same area in USDA, has a very similar program and Farm Bill dollars in a 10007, for those who are familiar with that, their program. So we've worked from their lessons learned, and we know that the Secretary approves every project. So that goes up to the Secretary. He approves every project that's funded through that program. So we anticipate that will be very similar for us. But our board, we're going to rely on them to make recommendations. Within each pillar, or each leg of the stool, we will also have an executive committee comprised of, so for the NIAA, we already have a nice governance structure between the Coordinating Council and the NIAA Executive Committee. We're planning to use that. No real changes at all for that because that works really well. That helps set the priorities for the NIAA. Of course, with the 2 new programs, we don't have that. So we would stand up an executive committee for the disease preparedness and response piece. That would be representative of each one of the eligible entities that could receive funding for that. So in the Farm Bill, there's 9 eligible entities that range from the universities to vet schools, veterinary organizations recognized by AVMA, producer organizations, tribes, state emergency management agencies, as well as federal agencies that will be eligible for that disease preparedness and response funding. And so we would look for representation from those entities to help to sit on the executive committee to ensure that voices are heard about the priorities and how we're spending the dollars. And then the vaccine bank, that piece is a little bit, because it is quite more sensitive, there would be limited representation on that executive committee. So if that makes sense, we would have basically an executive committee for each one of the 3 pillars. Those executive committees are going to look different based on the pillar that they're over, and above them would be an oversight board that would kind of tie it all together. So, Dusty, I know this came up when we were in Washington about how's this going to work. So that's internally how it would work. for how we oversight, how we determine priorities of the areas that we would fund or put out proposals for. And so the next piece is this implementation. So for the disease and preparedness, preparedness and response pillar, we would put out a request for proposals process. So that request for proposals process would reflect the priorities as determined by those executive committees with the stakeholder support and input for what types of projects, what areas for projects that we would want to be funded. And those will go out, they will be competed, they will come back in, we will have a review board made up of stakeholders to review those proposals and decide which ones should be funded. So that's how we're thinking that whole process would work. So those evaluation panels would review all those proposals and make recommendations about what should be funded within the dollars that we have received. So if those of you who are familiar with how NIFA, the National Institutes of Food and Agriculture, operate for their grants, we would operate similar to that, but one really important distinction. So for veterinary services, we use cooperative agreements. We do not use grants. And to us, that's a huge difference because cooperative agreements means that we're expecting a cooperative relationship, right? We will hold you accountable if you're going to be the one leading the project for your deliverable. We're not just going to hand you the money and walk away. That's kind of what grants might imply. It won't be that way. There will be that cooperative relationship back and forth. And for us, that's a really important distinction between grants. So you may hear that. Dr. Shear's really passionate about that topic or about that distinction, but for us it might be a small thing, but it is important for that. And so finally, the timeline. So the timeline, I don't even have it on here because at this point it's pretty vague. So we've been told by the Secretary that he will have the decision made about how we're going to split up the funding and allocate the funding by October. And he said then we will have our projects funded by December. That timeline scares us, frankly. October to December is really short. So we are very much hoping we will get some guidance and can start the engines rolling much before that because it's going to be a new process for us. And we want to make sure we're doing it right and doing the best that we can. So that is, I think, with that, Dusty, that's about all I have. I'm very happy to take questions. I hope that was enough details to give you all an idea of what we're thinking and where we're at with this process.